In Health Watch today, changes have been made to the breast cancer screening coverage guidelines, and they've already taken effect this new year. Here with more on what this means for women is Dorothy Gibbons, CEO and co-founder of The Rose. Good morning to you. Thanks for being here. It's really important for women to keep up to date with this information, which is why I'm thrilled you're here to talk about it. It can be confusing. We hear different things.
Absolutely.
What is the latest with this now?
The latest is that HRSA, and that's the Health Services Administration group, has said we're going to start mammograms at 40 years old. Now, this is huge. Last year, we kept hearing from the United States Preventive Services Group that we didn't need mammograms at 40. And the whole thing is insurance going to pay for it if you have recommendations that are saying you don't need it. So this new ruling by HRSA has been amazingly important, and it's something that if we don't really share it with women, they're not going to know about it and they're not going to take advantage of it.
For people who don't know anything about The Rose, it's an amazing place here in Houston where you're able to help any woman who needs her mammogram. It doesn't matter if you can pay. And if you go get your mammogram there, if you can pay, it helps somebody else.
It helps somebody else, absolutely.
Okay, so you see every day women who were in their early 40s being diagnosed, even earlier than that, being diagnosed with breast cancer, which is why you think this is so important.
That is so important, because if we find it early, then we have less treatment. If we find it early, you'll live longer. If we find it early, you'll have a better quality of life. So the idea that almost half of the people that women that we diagnose every year are under 50 years old, then think about that. They would find it late, and that would make all the difference in the world to their survival.
So what happens now if a woman goes and gets her mammogram? She's going to be covered if she's 40, or is she going to have to fight a little bit until all of this gets meshed out a little bit?
I'm so glad you brought that up, because if she has an insurance company that denies it, she needs to fight it. And I guarantee you, her health provider, the person that did the mammogram, should be helping her fight it, because it is still the law, and it's very much the law now with HRSA's ruling.
And why we want to catch this early is life, right? It can literally mean the difference of life and death. If you were to have breast cancer at 40 and you waited until 45 to get your mammogram, you might not have a fighting chance.
You might not have a fighting chance. And you know, the most years of life are found in that woman who is 40 years old. She's got the most years left to live. So why wouldn't we take extra care to get that woman in?
And you're all about prevention, right? So we want to catch it earlier, or we want to find out who's at higher risk, so that we can just make life so much more fulfilling for so many women. What is it, about 250,000 women will be diagnosed this year? Is that right, with breast cancer?
And the other part of it is we are seeing that younger shift in women younger being diagnosed more often. So again, this 40-year-old ruling and having it every year is very, very important. We need to be sure that women are following those guidelines.
All right, Dorothy Gibbons, thanks for your time from The Rose this morning. Thanks for making such a difference in our community, keeping women healthy. It's a powerful thing to do.
Thank you.
All right, we have a lot more coming your way, don't we?